President-elect Trump is rounding out his picks to lead public health agencies, the latest being Stanford physician and economist Jay Bhattacharya, whom Trump picked to lead the National Institute of Health. Bhattacharya has opposed widespread COVID-19 lockdowns in the past. Dr. Saju Mathew, primary care physician and public health specialist, joining us now. Doc, always great to see you. Welcome.
Hi there, Hannah. How are you?
Great, thank you. So Trump picked Bhattacharya to lead the NIH. We know he was very vocal about the lockdowns. He was very critical during the pandemic. So I have to ask, Doc, what's your reaction to the choice?
Well, I don't know Dr. Bhattacharya personally, but definitely he was very vocal about saying that during COVID-19, that there shouldn't have been any lockdowns for young people who are considered to be low risk of dying and having severe illness from COVID-19, that they should be sent out there. They should get infected and somehow develop some type of herd immunity. But he also did say that the elderly were the only people that should be guarded and protected. So I have a problem with that. Let's not forget that COVID-19, if it infects a child and the child comes back and hugs the mom and then hugs the grandmother, before vaccines, there was a huge risk, Hannah, that large numbers of people in one family could have potentially died. So that definitely concerns me.
Yeah, especially when we talk about the term herd immunity. So some of Trump's other picks have similarly opposed COVID vaccine mandates, those lockdowns. That includes Trump's pick to lead the FDA. So, Doc, how could they change the agencies they're set to lead?
These leaders, Hannah, obviously, I want to give them the benefit of the doubt. They should be scientists that believe that at the end of the day, science is all about either proving or disproving facts. We just talked about vaccines. Before a vaccine is approved by the FDA, it's gone through countless scrutiny. And then after that, as people get vaccines, we still follow that. Ultimately, I hope that these scientists will believe in science and let that lead the way. I don't know a lot of these people specifically, but of course, we know a lot about RFK and how he thinks that all vaccines are considered to be unsafe.
Can't we talk about RFK for our viewers? Just a friendly reminder, he is Trump's nominee for Health and Human Services. He has some controversial views on vaccines and, of course, other policy issues. Do you have questions about his ability to lead this department, Dr. Mathew?
Once again, I want to give him the benefit of the doubt in the sense that I have followed him very closely. He's a very interesting person. He's also tough to interview because in the same sentence, he will say things that make sense. Make America healthy again. 40% of Americans are unhealthy. We must change the way we eat. We must change the way that we look at exercise. And he's a very fit person. So I'm all on board when it comes to that. But in that same breath, he will also say that, hey, parents, if somebody approaches you and wants to get your children vaccinated, run away from them. He has been on record stating again, stuff like, all vaccines are considered to be unsafe and non-effective. And I have a problem with that for sure.
Let's switch gears here. Let's talk about the holidays. We know millions of people are traveling to see their family and friends right now. Doc, what's your advice on keeping loved ones healthy and safe this holiday season?
Well, first of all, you want to enjoy the holidays. This is after a long, stressful year. People are getting together, but try to do it in a safe manner. I'm a believer that if you're in crowded spaces during the holidays, when you're traveling, say, in planes and train stations, wear a mask, especially if you have a cold. Definitely make sure that you're up to date on your vaccines. Practice good hygiene and definitely get tested for COVID-19. And one last thing, Hannah, I'm a huge believer, we just talked about vaccines, in getting the flu shot and COVID-19 updated booster if you've not had it in the last 6 months. It's all about protecting the elderly and the vulnerable.
I'm glad you mentioned that because I was reading an article saying a lot less Americans are getting those vaccines this year. We always appreciate your time, sir. Dr. Saju Mathew, happy Thanksgiving.
Yeah, happy Thanksgiving to you too, Hannah. Thanks.
Of course, thank you.
Thanks so much for watching. Just go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.